Welcome everyone to our webinar, Chiropractic and Fall Prevention, presented by the Fall Prevention Community of Practice. My name is Lindsay Toth and I'm a project coordinator at the Ontario Neurotrauma Foundation. ONF sponsors Loop and the Community of Practice. Marguerite Thomas also joins us on the line. Marguerite is the coordinator of the Fall Prevention Community of Practice and will be assisting with the webinar technology. Before we begin, I'm going to give you a quick rundown on the Level 3 web meeting system. This webinar technology consists of two parts. The audio is provided through a telephone conference line, and the visuals are provided through a web platform. The phone number for the conference line and the link for the web platform were sent to you by email after you registered for the webinar with Level 3. If you have questions about the technology at any time during this presentation, please type them into the chat box located on the left-hand side of your screen. Alternatively, you can email lindsay@onf.org. We will work with you to resolve technical issues as soon as possible. This webinar will contain an opportunity for participation during a question and answer period at the end. If you have topic-related questions during the presentation, please type them into the chat box. During the Q&A, I will read those questions aloud to the group. If you would prefer to ask your question over the phone, we will provide the instructions to unmute yourself during the Q&A. I would now like to introduce our presenter for today, Dr. Neil Patrick. Dr. Patrick is a Doctor of Chiropractic with private practices in Creemore and Collingwood. Dr. Patrick, you may now unmute your line and take it away.
Thank you, Lindsay. Hi, everyone. I hope you can hear me okay. Thanks for joining me this afternoon. As Lindsay said, my name is Neil Patrick. I am a chiropractor. I have two offices, one in Creemore, one in Collingwood, which are each about 25 minutes away from each other. I guess to start out a little bit about me, if anyone cares at all, I'm a graduate of the Canadian Memorial Chiropractic College in 2004. That was a 4-year program. And before that, I did a degree in biological science for 4 years at the University of Guelph. I was born and raised in Oakville and started coming up to this area because we started skiing at one of the ski clubs up here, Devil's Glen, when I was a kid. So I always liked it up here, and I figured I might as well live where I want to play. So here I am. I opened my Creemore office in 2005. Creemore is pretty small. Most people, even up here, I shouldn't say most people, but I'm surprised how many people, even in Collingwood, don't even know exactly where Creemore is, but everyone's heard about it because there's a pretty good brewery there. So anyway, Creemore is a pretty tiny village, and I figured it wouldn't hold a full-time practice for me. So I opened my other office here in Collingwood in 2010. I guess I should switch to the first slide here. Hopefully I'm doing this all right. I'm not hearing otherwise. I am a community engagement volunteer with the OCA, which is the Ontario Chiropractic Association. As you can see from the slides in the bottom right, they have been very helpful to me in putting this presentation together. A lot of this is material that they pulled together for me with a little bit of my help, but I would like to thank the OCA for their help, and in particular Dr. Jennifer Nash, who was my liaison there, who did a lot of work helping me put this together. Also thanks to Lindsay Toth and Mary Beth Forget, who put together the virtual handout, and Marguerite Thomas, who contacted me initially about doing this presentation. I should probably give them a blanket apology as well, because I first heard from Marguerite, I think it was late July or early August, about doing this, which is right around when we were just having our second child. So it was a bit of a busy time, and I kind of naively said, yeah, sure, I'll do this 6 months from now, and here we are more than 6 months from now because there's been some delays and technical issues from my end. So I'm sure these ladies are quite happy to have me get through this today and be done with me. So thanks for your patience with me and for all your help with doing this. So what I want to cover with my presentation today is, first of all, just some general background on chiropractic, not so much to toot our own horn, but I do find a lot of people don't really know much about what we do or how we do it unless they happen to be patients of ours. So I'll give you some information on chiropractic assessments, diagnosis, and treatment, treatments to increase strength and flexibility and stamina, particularly when it comes to patients with falls risks. Exercises we might give people to minimize risks, and I'll touch on some collaboration and interprofessional care, in particular some other developments with our profession and our role in the public health care system, which I'll touch on at the end of the presentation. So what is chiropractic? I'll try not to completely read the slides right to you to insult your intelligence, because I imagine everyone here can read English, but my apologies for this one, I probably will. So chiropractic is a non-invasive hands-on healthcare discipline that focuses on the musculoskeletal system. Chiropractors practice a manual approach providing diagnosis, treatment, and preventive care for disorders related to the spine, pelvis, nervous system, and joints. So chiropractors are experts in the assessment, diagnosis, and treatment of neuromusculoskeletal disorders resulting from conditions affecting joints, ligaments, tendons, muscles, and nerves. We provide treatment and management of such conditions or disorders, primarily with use of manual therapies, including manipulation and soft tissue therapy. We also provide nutrition, therapeutic exercise, lifestyle, and ergonomic counseling and recommendations to patients. So a physician referral is not required in order to secure chiropractic care, as chiropractors are considered primary care or frontline doctors. In Ontario, we're one of 5 professions officially granted the title doctor, I think sort of based on our rights and responsibilities to diagnose. Those 5 professions would be obviously MDs, as well as dentists, optometrists, psychologists, and chiropractors. In Ontario, chiropractic is regulated under the Regulated Health Professions Act, or RHPA, as well as the Chiropractic Act, which I'll get to in the next slide. And the governing body established by the provincial government to regulate our profession in the province is the College of Chiropractors of Ontario, or the CCO, which is different from the OCA, as well as the CCA, or the Canadian Chiropractic Association, both of which are organizations who represent the chiropractic profession sort of for our benefit, whereas the CCO looks out more for public interest. So the Chiropractic Act outlines our scope of practice. Again, I'll have to read this one to you. The practice of chiropractic is the assessment of conditions related to the spine, nervous system, and joints, and the diagnosis, prevention, and treatment, primarily of adjustments, or by adjustment of dysfunctions or orders arising from structures or functions of the spine, and affects those dysfunctions as disorders of the nervous system, as well as dysfunctions or orders or disorders arising from the structure or functions of the joints. What does that mean? Basically, we're typically seen as back or spine doctors for most people. I often explain to patients that we deal primarily with joints in the body, to summarize it. The spine is just the largest collection of joints really in the body, so that tends to be our focus or what we're known for doing. Some people are surprised that we're quite capable of working on other joints in the body as well. So what our education and training entails, the prerequisite for chiropractic college is a minimum of 3 years of an undergraduate program in anything. I did a 4-year biological sciences degree, as I mentioned, before going into chiropractic college, which was a 4-year program. It's 4,200 hours at least from an accredited program, after which graduates have to complete national competency examinations and then apply for licensure and acceptance by provincial regulatory boards. In Canada, there are officially 2 chiropractic colleges. The main one is CMCC, which is the Canadian Memorial Chiropractic College in Toronto. That's where I went to school. There's another small program in Quebec that is francophone, which is the Trois-Rivières. I'm not francophone, so that's not an option for myself, and it's a relatively small program there. So those are the only chiropractic programs in Canada. There are a number of schools in the States and some others throughout the world, but CMCC is the main school in Canada. The first 2 years of the curriculum emphasize the foundational courses in biological sciences, such as anatomy, physiology, pathology, microbiology, etc. Beginning in year 1 and becoming the emphasis of the program in years 3 and 4 are more focused on the professional courses in chiropractic studies, psychomotor skills, clinical education, and the regulated health professional courses such as business, jurisprudence, ethics, and professionalism and research, etc. In addition to the academic elements of the program, chiropractic education requires hands-on clinical experience under the direct supervision of highly qualified chiropractic faculty. This experience includes clinical assessment, diagnosis, treatment, and referral protocols of real patients. Our final year 4, is a full internship year. We do, at least when I was still in school, I don't think it's changed, we did 2 6-month rotations as interns. CMCC has a pretty large clinic on its campus, as well as a number of external clinics, one of which I got to do a rotation at for half of my year. I worked at, or did my internship at Sherbourne Health Centre, which is affiliated with St. Michael's Hospital in downtown inner city Toronto. So an interesting patient base, and it was quite a good experience there. So where do chiropractors work? Many chiropractors work either in solo practices or in partnerships with other chiropractors. However, it's very common for chiropractors to work in private multidisciplinary clinics with other manual therapists, such as physiotherapists or registered massage therapists. However, there's lots of room for growth when it comes to building relationships with publicly funded providers, including nurses and physicians. As I mentioned, I will outline a couple of projects on the go at the end of the presentation. Some chiropractors have been collaborating with primary care providers and interprofessional teams in a variety of structured referral and co-location arrangements for many years. There are many examples of chiropractors working as part of primary care teams or with solo or group physician practices, but who are not publicly funded. For example, in the case of some location or co-location relationships with family health teams, chiropractors may bill patients as they would in other settings. They may pay rent or other overhead costs to their practice. And they also may provide some pro bono consultations and treatment to rostered patients who may be unable to pay. It's also very common for chiropractors and physicians or groups of physicians to work together in less formal, structured circumstances through developing reciprocal referral relationships gradually over time. For myself, my Creemore office is in the Creemore Medical Center, so I just have a small office space there. I'm across the hall from a family doctor, and there's 2 more family doctors and a dental office upstairs. So that would be the situation where I'm working independently, but especially over the years, I've certainly developed personal and professional relationships with the other physicians and dentists and their staff there. My office here in Collingwood, I actually rent a room out of a physician's office. There are 2 family doctors I work with here. So again, it's an informal relationship where, selfishly, my hope is they'll refer some patients to me, and I, hope I can provide some help to them with musculoskeletal cases that isn't so much their forte. But we do work quite closely together, literally, bumping into each other in the hall and working very directly together like that. So far, anything publicly funded is not very common, unfortunately, yet, in Ontario anyway. The box on the bottom right of this slide highlights the opportunity for chiropractors to be hired on in funded roles and into professional primary care teams. In October 2013, the Ministry of Health and Long-Term Care announced a policy change which allows family health teams and nurse practitioner-led clinics to employ chiropractors as part of their teams. And also at that time, it was confirmed that there are no policy barriers for community health centers and Aboriginal health access centers hiring chiropractors on their teams as well. So of those 4 models of interprofessional primary care teams in Ontario, that is the family health teams, nurse practitioner-led clinics, community health centers, and Aboriginal health access centers, they all do have now the ability to employ chiropractors. So the area I live in, especially, a significant part of my patient base is older adults.